We can and we must reopen schools in the fall for in-person teaching, learning, and support. And we must keep them open fully and safely 5 days a week. The United States will not be fully back until we're fully back in school, and my union is all in.
That's the head of the union that represents nearly 2 million teachers. She's pushing to get all kids back into classrooms with the Pfizer vaccine. Now approved for use on kids as young as 12, that's certainly going to help. But there are still a lot of open questions about masks for both children and adults. Store to store, state to state, confusion for many Americans.
Okay, should I take my mask off? Should I leave it on? It's super confusing.
The CDC issuing new guidance last week saying fully vaccinated people don't need to wear masks in most cases. From the Las Vegas Strip to the ballpark and the French Quarter in New Orleans, many rejoicing over the weekend. But businesses, employers, states and cities can still make their own rules. Trader Joe's lifted its mask order and Starbucks has made them optional. But 22 states still have some sort of mask mandate in place, meaning in those areas you'd still have to wear face coverings regardless of retailer policies.
If they're vaccinated, they are safe. If they are not vaccinated, they are not safe. This is not permission for widespread removal of masks.
So far, the CDC says more than 123 million Americans are vaccinated, about 37% of the population. But the largest nurses union in the country is condemning the decision, saying it puts those who are immunocompromised, children and frontline workers, at risk.
Those that have gone to work every single day during this pandemic, they depend on every layer of protection.
Some experts agree it's too soon.
There are a lot of people that are not yet fully vaccinated that are still in the process, and I think we should wear masks for them.
Is it time?
No, for me, not enough people are vaccinated for me to really feel safe, because how do you know if somebody's vaccinated or not when they're not wearing their mask?
For more on all things COVID and masking related, we turn to an expert's expert. Dr. Richard Besser is a former acting director of the CDC. He's currently president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, we saw more than a little bit of mask-related whiplash last week after the CDC surprised many, changing its masking recommendations for vaccinated Americans. Lots of people still figuring out what their own personal masking policies are going to be. That leads to two questions. First, do you agree with their changes? And secondly, I assume you're vaccinated. What's your personal policy for indoor mask use? Where do you still wear one?
Yeah, Andrew, I do agree with the changes that CDC made, and I think you're spot on that it's going to take a little while for states, localities, businesses to figure out how to implement this. The science is clear that if you are fully vaccinated 2 weeks after your final dose, you have incredibly high levels of protection. These are some of the highest levels of protection we've seen from any vaccine. And so I was really excited. I am fully vaccinated. I'm enjoying going outside and not wearing a mask, but I'm in New Jersey, and in New Jersey, the indoor masking rules and regs are still going to stay in place, given we've seen very high cases of COVID until very recently.
People still do have questions about how to handle or the possible risks from unvaccinated people going maskless. Obviously, they should get vaccinated is the mantra, but we know that many won't. We know it's an obvious danger to the people who aren't vaccinated, but why isn't it a danger to vaccinated people, especially with all these variants still running around out there?
Yeah, so it's going to be important for CDC to continue to monitor cases in the United States. Do we continue on this steady downward movement, or does it reverse? And it's important to watch for variants. But right now, we're very fortunate in that the variants that we're seeing in the United States are covered by the vaccines. And vaccinated people really are at very, very little risk from someone who is unvaccinated. The concern, Andrew, though, is that not everybody is vaccinated, and children under 12 don't have vaccines available to them. And so it's very important that parents with young children continue to follow those masking rules, and that people who aren't vaccinated wear masks to ensure that they're helping to protect those people who can't be vaccinated right now.
As you mentioned, among the groups having the greatest difficulty dealing with the change in policy are businesses who now have to balance worker and customer safety with the risk and hassles and headaches that come from telling angry people that they need to mask up. What advice would you give to businesses? What criteria should they be using to determine their own mask policies?
Well, I think there's a couple things. First is they need to follow the local and the state rules and regulations on this. Beyond that, they need to make sure that their workers have full access to vaccination, because while there are enough vaccines for everyone in America who wants them, for many people there's still challenges and there are barriers to getting vaccinated. Black Americans, Latino Americans have been vaccinated at much lower rates, and a lot of that has to do with barriers. Many people can't take time off work to get vaccinated, and if they have a sore arm or feel pretty lousy the day after, they don't have sick leave to take off. So can we make it easier and easier for people to be vaccinated? But if you're a business, you want to know, are your employees vaccinated? Especially if you're thinking about a setting like a restaurant or a crowded bar, you don't want to put your own workers in harm's way by having people in there who aren't wearing masks, even though they've not been vaccinated themselves.
To that end, that uncertainty certainly could make for a more compelling case for vaccine passports so businesses can better identify who's vaccinated and who's not. Right now, that's all a state-by-state decision. New York uses one, Florida has outlawed them. Do you think we should be leaning more on vaccine passports?
Well, it's such a divisive issue in America right now that I don't think, even if it's, it would be wonderful if you had an easy way to know whether someone was vaccinated. I just don't think that there's the political reality to make that happen. The federal government is not going to mandate that, and each state will end up having their own practices. One of the things that we'll continue to watch is the number of cases that are occurring each day. And, if that gets down to a level that is very comparable to what we would see in a typical flu year, then I think that we can all breathe a little sigh of relief and recognize that, yes, there will be some disease transmission, but the people who are at the greatest risk for severe disease, for hospitalization and death, will have broad access to vaccination. And thankfully, I'm a pediatrician. Thankfully, young children are at very low risk for having severe COVID infection. It's still worth protecting them. We have lost several hundred children from COVID, and there are thousands who've developed a rare inflammatory condition. So you don't want to take this lightly. But thankfully, your risk of having severe infection goes way down as you get younger.
What about in schools? Does that lower risk for kids, if you will, lower the need for vaccination? Should they be required for in-person schooling for kids 12 and older?
Well, this is something that's decided on a state-by-state basis. The federal government can make recommendations on that, but it's decided on the state basis. I would think that for many parents, having their kids vaccinated is going to be the right decision. The reason for that is thinking about children going to middle school, going to high school, being able to do that and potentially taking off their mask and having a somewhat normal or quite close to normal experience would be an absolutely wonderful thing. Thankfully, there's vaccines for teachers and staff since they are at a greater risk of having severe infection. But I think it's really important that parents ask questions. They get answers to their questions so that they can make a decision that's right for them and their families. They can go to a website, getvaccineanswers.org. And it's got great information there that should address most parents' concerns. But if not, talk to your child's doctor. Make sure that any questions you have are getting answered so that you can truly make an informed decision.
As a former acting director of the CDC, do you think the Biden CDC handled this mask policy or recommendation properly? There's been reporting that the current director, Dr. Walensky, had signed off on the new mask recommendations, even as she testified to Congress about the importance of the older recommendations earlier in the week. I'm sure you can see how that might generate more questions. You think the CDC handled it properly?
Well, I think the outcome is the right one in terms of this recommendation. I would have liked to have seen some more foreshadowing so that we had insights into the thought process. maybe a week ago, 2 weeks ago, hearing that CDC was looking at the trends in America, and if they continue to come down, we might be able to loosen up some of the requirements. They were looking at studies about how these vaccines work in real practice, and if they continue to show the incredibly high effectiveness, that might lead to a change. And they were looking at the data to see, could people who were fully vaccinated still spread infection to others? And there was encouraging signs. So there are ways of giving hints to the direction that you're going without saying it's a conclusion that might have helped bring people along so it wasn't quite so surprising.
Finally, Dr. Besser, I spent some time online this week trying to listen in or read in on what vaccine skeptics were saying. And many came to the point that the vaccines aren't approved, that they've only got emergency use authorization. So hoping you can help me tamp down some of those questions. Is there a difference between those two statuses? Should that impact whether somebody gets a vaccine?
Well, there is a difference. The bar for getting an authorization from FDA in emergency is lower. And so these vaccines were approved or authorized based on 2 months of safety data and effectiveness data. But we're way past that now. And now we've seen these vaccines administered to hundreds of millions of arms. And we've seen how incredibly safe they are and how incredibly effective they are. It's my hope that soon we'll see a full approval. But for people who are waiting to see, are they safe? Are they effective in real use? Those questions have been answered, and they've been answered in ways that give me a lot of confidence when I recommend these vaccines for my patients, when I recommend them to my patients' families and to my own families and friends.
Some fantastic insight from Dr. Richard Besser, former acting director of the CDC, now president of the Robert Wood Johnson Foundation. Dr. Besser, thank you so much. Appreciate it.
My pleasure. Thank you.
And up next, we pivot to politics. Republicans haven't been able to hamstring President Biden yet, at least when it comes to how the public feels about the president. So now they're trying to make every bad news story his fault. That and other potential worries for Democrats next.